Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Ask Anonymous. That's where the patients write in questions and then I answer them the following week. So we have some good questions this week and we're going to get right at it.
Is it possible to have abdominal liposuction after someone has had an abdominoplasty about 15 years prior?
Yeah, it's actually very common. Even after a tummy tuck, years later, your body habits can change, or weight can fluctuate. So many times you don't really need to do anything to update the tummy tuck, but you can modify it with some liposuction, usually the hips or flank area and the abdominal wall.
All right, the next question. I want to try a filler, but could there be a possibility that I would have an allergic reaction or something?
It's extremely rare to have an allergic reaction to dermal fillers now. They're basically made in the lab. They've taken the backbone of collagen, where in years past we've had to do test spots because it was an actual collagen product. But nowadays it's extremely rare to have a reaction to the dermal filler. So I think you'll be pretty safe to start.
What is the cost of a mini facelift, and does it tighten the neck area up?
That's kind of a complex question. So it depends on what you mean by a mini facelift, and we've talked about this in the past. So some people refer to a mini facelift as a lower facelift or a neck lift. Some just feel like it's just a little bit of a tightening, but in this case I think you're referring to a neck lift, and that would be the lower jaw area and the neck. And so that is what I would call a neck lift, and it's usually incisions right around the lower part of the ear and back up high behind the ear and into the hairline. And that does lift the neck. That's the whole goal. It lifts everything up from the sides, and depending upon what we need to do, then the cost would vary. So for those kind of patients, I really need to see them in the office, face-to-face consultation, because you might be keying in because you're seeing this more, but if you have some aging of the mid-face, then that's going to have to be addressed at the same time. Otherwise, you create an imbalance. So a lot of times patients will come in only wanting a mini facelift, and they sometimes require a full facelift, and the vice versa is true as well. So a lot of patients will come in thinking they need a full facelift, and really the neck lift might be a good alternative for them. So it'd be nice to see somebody like that in consultation. Also, if you just have a little bit of aging, sometimes we have some non-surgical ways of treating and tightening that skin and soft tissue of the neck without actually having a larger surgery.
And pricing is typically discussed?
So at the consultation, once I examine the patient and we go over all of the findings that I see and what the patient is also looking at, then we go over a game plan, and from there the patient will meet with my patient care coordinator and go over a fee schedule.
Okay, do I need to lose weight to get a breast reduction? I need a breast reduction ASAP because I'm having a lot of painful physical issues, but I'm worried that I'm required to lose weight for it.
You don't necessarily have to lose weight, and it really depends. I do most of my surgeries in a surgery center, so there's a BMI cutoff of about 41 to 42. So we like our patients to be a BMI of 40 or below. So depending upon the height and weight of the patient. Also, insurance companies use the height and weight to basically come up with a number of what we're supposed to remove. Years ago, it used to be the surgeon telling the insurance company this is what we thought, how many grams we'd have to take off of each breast to alleviate symptoms. For the last several years, it's now the insurance company imposing that onto the surgeon. They're using something called a Schnorr scale, which is a relationship of height and weight and a variable. So depending upon your height and weight, it's hard to say. Again, those are the kind of patients I would like to see in the office. There have been times where patients have lost a lot of weight and now are not a candidate for a breast reduction. So I'd like to see somebody like that prior, and we can have that discussion.
How would you most effectively remedy orange peel skin texture around the chin area?
Good question. So it really, again, depends on the tone of the skin, how much sun damage there is, so we have to do a full assessment. Now, if you're having that orange peel look, kind of that pitted pores and a little bit of deepening of the skin, that thickening. When you're in animation, then sometimes Botox or neurotoxin can help alleviate that, because it's because of the muscle pull around the chin. However, if you have larger pores around the chin and that's something that you notice while you're at rest and not animating, then we can use things like microneedling with radiofrequency and our helix laser, which is a combination of CO2 and a 1570 partially ablative laser.
What are your thoughts on breast fat grafting? Is it worth it, and does it last?
In a nutshell, it's not that I'm opposed to fat grafting. I think fat grafting is very effective. We use it a lot. It's a good tool. I do fat grafting with breast reconstruction. Personally, I don't like fat grafting for a breast augmentation solely, because it takes usually 2 and sometimes 3 surgeries to achieve the amount that the patient wants. And you have to have the right amount of donor site. The other thing is there's downtime with that, more so than just a regular augmentation. Personally, I like to use breast implants, usually silicone. I think they're very stable, they're safe. And then if I need to fill in around that to add more fullness in the upper pole or the upper part of the breast, the cleavage, if a patient's real thin, even though I put the implants under the muscle, sometimes you can have a little bit of waviness in the skin just because the skin, there's not a lot of subcutaneous fat there. Then I'll use a fat grafting to help fill that in. But I think if you can undergo an augmentation in one surgery, taking about an hour of surgical time, a pretty quick recovery, as opposed to doing a fat grafting in sessions where you're doing it 2 and 3 times, plus that becomes financially much more expensive to do it that way.
Can you explain the blepharoplasty procedure for both hooded eyelids and lower eyelids? Can you do something to remove wrinkles under the eyes?
Yeah, so hooded eyelids, if you have some excess skin on the upper eyelids and it's not the position of the brow, so one of the things you have to be examined for is the position of the brow. And you can see when I demonstrate, if I pull my brow up, the skin on my upper eyelid becomes shorter, so you have less skin up there. So when you get examined, the surgeon has to put the brow in the right position to make sure it's only the skin of the eyelid that's the problem. Sometimes patients have sagging of their eyebrow, which makes it look like they're sagging skin. In those cases, you have to do a brow lift. But if it really is just that excess skin, it's a very simple operation to remove that skin and some simple sutures. I usually do those under IV sedation. The whole surgery takes about 30 minutes. It's very quick and easy. The lower eyelid is a little bit more involved, depending upon if you have fullness or fat pads under the eyes that need to be addressed and extra skin. So if it's the fat pads, in some cases, I'll need to do an incision on the mucosa on the inside of the eyelid called the conjunctiva inside, go in and remove some of the fat from those fat pads, and then do another incision underneath the eyelashes to remove some of that excess skin. There are other ways, and some patients can be candidates to doing or treating the excess fat and some of the skin in a non-surgical way when we use the what we call Virtue Exact, which is our microneedling radiofrequency, and it takes about 5 treatments under topical anesthetic where you can go in and treat the fat and then also the excess skin. And sometimes we can use our helix laser, again with the CO2 combined with a 1570 partially ablative laser, that can really tighten the skin on the lower eyelids. So the lower eyelids, depending upon how much skin and fat is there, sometimes we have to go to surgery and sometimes we can do it non-surgically.
Okay, how much for a breast reduction?
The majority of times breast reductions can be sent to your insurance company for approval, and there are criteria for that depending upon the insurance company. You have to have 3 to 6 months of documentation from your primary care or gynecologist, talking about you have pain in your shoulders, your breasts, your neck, you're limited in your activities, you're developing rashes underneath the breast. One of those doctors has to have prescribed prescription strength antifungals or hydrocortisone creams, and you have to have that documented for about 3 months. And then you have to come in, be examined, photos taken, and then again, we also have to, at that time, estimate how much weight we're going to take off of each breast, and that has to coincide with that Schnorr scale that I had mentioned before. So the majority of breast reductions can be put to your insurance company. If you don't have an insurance company, or an insurance company doesn't cover it, yes, then we have a fee schedule for that, and would have to take a look and again, examine you, and then you can talk to Tony, our patient care coordinator.
I would like liposuction on my neck and chin area. Can I get that done without getting a facelift?
Yeah, in many cases, we use, in my practice, we use our Lipo AI, which is laser lipo. Many of the times we do it actually here in our procedure room, in the office, under some oral sedation. And we've demonstrated that on some different videos if you look on the website. But we can make a 2mm incision right here underneath the chin, so it doesn't even need a stitch. And we can internally use this laser lipo to laser the fat and the tissue, dissolving the fat, and then I use a tiny liposuction cannula and aspirate that fat. And you wear a chin strap for about 2 weeks. It's a pretty quick, easy recovery. The whole procedure takes about an hour. So a lot of times that can be done here in the office. And again, it really depends on how much aging you have in the lower neck and what we call the submental area. So you can do that for sure without a neck lift, but there are times where you're going to have some excess skin and you may benefit from the neck lift to remove that extra skin.
Approximately how long should I expect my results from a facelift to last?
We generally say facelifts last, again, probably around 6 to 10 years, so on average about 8 years.
Does having lipo of the abdomen make it harder or impossible to then have a full or partial tummy tuck later?
No, it won't interfere with a tummy tuck down the line. And so in many cases, I will do liposuction of the back, the hips, the flank, and the abdominal wall to reduce the adipose tissue in those areas, wait about 3 to 6 months, and then come back and actually do the tummy tuck at that time. I also do the reverse. If I'll do, sometimes in some cases, I'll do the tummy tuck first and then come back and touch it up with liposuction of the abdomen, hips, and flanks.
I have experienced a relatively mild stroke on November 2023. Subsequently, I have been taking clopidogrel and low-dose aspirin daily. In the years prior to this experience, I received moderate facial fillers and Botox-type injections.
So somebody who's had a stroke of any nature and is on Plavix, which is what that drug is. So it's Plavix and a low-dose aspirin. At this time, depending upon what your doctor wants to do with the Plavix, most of the time you're on it for, could be for the rest of your life. Sometimes you're on it for 6 months, a year, just depending upon the stroke and the symptoms and the residual weaknesses from that. But at that time, as long as you're taking Plavix or any other type of blood thinner, you're not really a good candidate for neurotoxins, dermal fillers, or even a surgical procedure, because you can't safely stop that drug around the time to do those procedures and then start it up again. Sometimes stopping that drug is more detrimental or can be worse, and you might be at a risk for another stroke. So as long as you're taking those medications, I wouldn't advise having any type of invasive procedure done. And I think, really the lasers that we have here are also contraindicated for like resurfacing lasers as well. Well, thank you. I hope this answered all of your questions adequately. We're going to do this again in about another month, so everybody will see it posted, and we'd love to have all of your questions and go through them for you and answer questions. And if we can be of any other service to you, please follow us on our social media, look at our website, and we're always happy to help.